And that's the big story tonight here at 8 p.m. I'm Sana Khan. It's sad and it's not new. Healthcare in India continues to be in shambles. A sorry, pathetic state of affairs. Hundreds of children have lost their lives. Why? Medical apathy, negligence, and what seems to be a collapsing healthcare system. Lots to talk about on the show tonight, but first, a look at this report that sums up the grave tragedy. The story is not of one state or two. It's about time the governments, both at the centre and states, stand up and take notice and punish those responsible. From Gorakhpur in Uttar Pradesh to Jodhpur in Rajasthan and Jamshedpur in the state of Jharkhand. More than 100 precious lives lost in a matter of days. Medical negligence, medical apathy, and clearly failure on the part of the state. 61 children, mostly newborns, died in the last 72 hours in what's described as Gorakhpur's hospital of horror. In the last 24 hours, 19 children have died at the Baba Raghav Das Medical College, 4 from encephalitis. The rest were babies who died in the hospital's neonatal intensive care unit.
I was in Gorakhpur on the 17th of this month and I visited the hospital, and at that time, after seeing all the horrible things that had happened there and visiting some of the parents, we had given a message and an appeal to the district administration and also to the state government that look, there are floods in the adjacent districts, there are heavy rains, so there is going to be a huge influx of patients and of sick children. What are you doing to meet this influx? But unfortunately, this plea has also fallen on deaf ears and nothing was done.
Just a fortnight ago, 70 infant deaths were reported at the BRD hospital from various causes, including oxygen shortage.
I don't think so that in one medical college you can have 20 deaths per day, and that too in children. It's a matter of concern, and only 7 of them are encephalitis. And even in the encephalitis deaths, we need to know how many are preventable.
The grim state of affairs do not end here. 52 infants have died in the span of 30 days at Jamshedpur's Mahatma Gandhi Memorial Medical College Hospital in Jharkhand. The deaths call to attention the healthcare of women and extent of malnutrition in India's 10th poorest state by per capita income.
This again highlights the fact that how less we are spending on our entire health system. The budgetary allocation is less than 2% for the entire country. So I think this incident these deaths of such a large number of children should wake the nation.
Just when you thought it couldn't get worse, here's the shocker from a Jodhpur hospital in the state of Rajasthan. While a woman undergoes emergency C-section, doctors performing the surgery are engaged in a verbal spat. All of this shot on camera by the nurse inside the operation theatre. The woman lost her child.
प्रथम दृष्टया दोनों अशोभनीय भाषा के दोषी दिखते हैं, अतः मैंने सरकार से इनके विरुद्ध सख्त से सख्त अनुशासनात्मक कार्रवाई करने की अनुशंसा की है और शीघ्र ही सरकार ने भी इस रवैये को बहुत सख्ती से निपटने के लिए लिया है.
Gorakhpur, Jamshedpur and Jodhpur reflect the state of India's poor and its lack of health spending. According to a study in 2015, India had the highest under-5 mortality rate among BRICS nations at 43 deaths per 1,000 live births. Despite poor health indicators, the country spends just 1.18% of its GDP on healthcare. The global average is 5.99%. Sana Khan for WION. All right, and this brings us to some big questions that we are raising this evening on the show. Is the Indian health establishment apathetic towards patients in the country? Is it professional incompetence or plain callousness on the part of the authorities concerned? Can the powers that be get away by citing population pressures? And can such apathy be defended citing work pressures? Another question that comes to mind is, does India spend enough money on healthcare? And the most basic question that comes to mind, has India stopped valuing human lives? To talk more about this, joining me here is Dr. M.C. Mishra. He is former director of the All India Institute of Medical Sciences, and he has now been appointed as the honorary senior consultant at the Sir Gangaram Hospital here in Delhi as well. He joins me from Jaipur. Dr. Mishra, thanks so much for joining me. Dr. Rajiv Sood, Dean of Ramanolohia Hospital and member of the Medical Council of India, is joining me over the phone line for the moment. But my first question to you, Dr. Mishra, is what is happening? Where the system is clearly failing, how can one stop this?
I think you have already summarized very beautifully that what ails the Indian healthcare system, that we have total apathy towards life, and particularly of those who come from low socioeconomic group, like in BRD Medical College Hospital. And this has been happening year on year, that we see sometimes the Japanese encephalitis is blamed. But as I think Dr. K.K. Agrawal was commenting, that all the deaths are not due to JE, they are also due to some other reasons where these neonatal deaths have happened. And it is not in 21st century. We are, for God's sake, we are in 21st century. And it is totally unacceptable to have that kind of a system in any medical college hospital, worth the name. Forget about AIIMS or other institutions of national importance. So I think it is the seriousness with which these things should be tackled. They are not tackled. And then certain professionals are made scapegoats and their action is initiated against them. But the whole, as you rightly mentioned, that the money required, the trained human resource required is practically not there. And otherwise, having so deaths every day and not recognizing and seeing the signs and symptoms of early disease and letting these children killed is unacceptable in any healthcare system worth the name.
Absolutely. In fact, if Dr. Rajiv Sood is on the line with me, I'd like to ask him, Dr. Sood, would you agree with what Dr. Mishra just said? And also, take the case of Jodhpur, for instance. Now, the Code of Medical Ethics very clearly says, and I'm going to quote what the Medical Council says in this regard, it says, any medical practitioner having any incapacity which is detrimental to the patient or which can affect his performance vis-a-vis the patient is not permitted to practice his or her profession. In the Jodhpur case, Dr. Naniwal, who is the assistant professor, he has been demoted to the position of the medical officer. Do you think actions like these are enough?
I'd like to comment at the outset that the very fact that this doctor was promoted or was appointed against the regular post makes it very clear that our system is plagued by vacancies, by shortage of manpower. Our manpower ratio, which should be, let's say, 1:1100 or 1200 is 1:2100 or 2500 in some places, and in government institution it is 1:16,000. So main problem is the crunch of manpower, and doctors and the working atmosphere, infrastructure, we are lacking very badly.
Right.
And you have rightly in the beginning told that for last 30 years we are struggling that GDP, the percentage of GDP spent on health should be improved.
It's abysmally low, sir. It's abysmally low.
It is abysmally low. It is actually from the global averages, it is 1/4 and or 1/3. And if you see, our neighboring countries are spending more there also.
This is basically the interpersonal behavior was unbecoming of a professional. If you see that video clipping,
It's shocking. Yes, it's shocking.
It is shocking. It is just shocking. whatever differences you have, you sort them out after you have dealt with the patient, and don't try to do things such kind of a altercation in front of the patient. Patient is in the OT table. And this was
Okay, Dr. Mishra, let Dr. Sood complete and then I'll come to you.
I told you at the outset, I must tell you that in what circumstances we are working. And these are the government hospitals, not only government hospitals, some heavily loaded hospitals where the work pressures are there and their mental stress and other
Absolutely,
things are
I agree. Coming from a family of doctors, I will have to agree to an extent with you that yes, GDP, not enough money is allocated, but what's the excuse of the case in Jodhpur? But Dr. Sood, you saw...
I will not like to defend anybody and they should be punished.
This is defending the indefensible.
In front of you, and life and death situation is there, then other different trust we can sort out later on.
I mean, one second, Dr. Sood. You have a case where you have doctors, lives are on the line, and these doctors are fighting. It's a verbal spat. Dr. Mishra, how can one defend this? The baby, he lost his life. God knows what exactly happened. A probe is being conducted. But what would you say to case in Gorakhpur, encephalitis? It's been happening year after year. Nothing is new. And yet we don't have a solution.
Absolutely. I think this case, Jodhpur case, I would say that there is no excuse for more number of patients to behave like this, number one. I think both these doctors counseling, they need some remedial psychological counseling that this behavior, it is a behavioral problem and nothing to do with, and this was one patient they were treating at that time. It was not a huge number of patients which were queued up. So I think I have been in this profession for last 40 years and I have not seen that at single time I had to lose my temper while in this situation or any other situation with a colleague. And I have seen my large number of teachers who have never shown that kind of a behavior, and this is just not acceptable, and both these doctors need to be sent for correction, and punishment is not the answer. It is the correction of their behavior which should be done through counseling, psychological counseling, improving their communication skills and also how to behave with each other when they are dealing with a precious life. I think that is what is required. And there is no excuse that more number of
I would go ahead and say they violated the Hippocratic Oath and they shouldn't be allowed to practice. They can't take people's lives, like this. They have to take people's lives seriously. I'd request you, Dr. Mishra, to please stay on with me. I think we've lost Dr. Sood there for a bit. But let's get our viewers some of the other reactions that have been pouring in on all of these stories that we're tracking. Take a listen.
The stand of the Uttar Pradesh government, the Chief Minister and the Health Minister, they have maintained that the month of August is a month of deaths for children. Is this an illegal slaughterhouse or a hospital? What are we seeing?
The Prime Minister should have just one minister for one hospital of Gorakhpur. And within 6 months, before giving him some other portfolio, that hospital, minister should transform the Gorakhpur hospital into the most modern hospital of Uttar Pradesh. Then public confidence will return. Otherwise, the corruption is from top to bottom. All this is due to corruption.
इतनी दर्दनाक, इतनी अमानवीय घटना के घटने के बाद यदि चिकित्सा मंत्री सो रहे हैं तो उसका परिणाम ये निकला कि माननीय उच्चतम न्यायालय ने खुद संज्ञान लेकर के कमेटी का गठन किया, राज्य सरकार की चिकित्सा व्यवस्था पर अविश्वास व्यक्त किया है।
अभी जो वहाँ के प्रिंसिपल है उन्होंने कहा है कि हमने जो है उन डॉक्टर्स को ड्यूटी से हटा दिया। भाई वो ड्यूटी से हटाने का क्या मतलब है? इन डॉक्टर्स के खिलाफ पूरी लीगल कार्रवाई होनी चाहिए। एक जो है इंसान के मारने का वो सब मरने का सबब बने हैं, उनके ऊपर तो मर्डर का केस चलना चाहिए।
Well, it's interesting some of the reactions over there. For instance, Dr. Subramanian Swamy, he says that the state government should take notice and they should come up with facilities which are world-class in these hospitals. Though his idea, his vision seems to be, it's really commendable. But can that happen? I mean, we're struggling. We're a country which accounts for perhaps one of the great, highest revenue when it comes to medical tourism. But when it comes to public health, when it comes to taking care of our own, we fail miserably. Dr. Sood, why is it so?
I would like to defend anybody who has done, and it is right sentiment that the proper action should be taken against them. And once this case is investigated in the primary inquiry, and after that it will come to obviously Medical Council of India, and I'm there and we are there looking at it, what is the preliminary inquiry. At present, apparently from the video it is clear that it was a gross indiscipline and gross neglect, which is going to come obviously to Indian Medical Association also. And we are going to deliberate on that. Medical Council of India is...
What do you think, sir? What do you think, logically speaking, should be the answer to something like this? An action that is befitting to such a grave, I don't know if it's right to call it murder, but it's certainly a case of negligence where the doctors are more engaged in their verbal spat rather than taking care of the patient. What do you think should be an apt action?
I will not preliminary, seeing the circumstances and seeing the video, I will not call it straight away murder. Let it be investigated. But the newborn was in very precarious situation, heart was dipping. But then comes the role of doctors who should have been attentive to the condition of the newborn and condition of the lady who delivered the child.
And Dr. Sood, one of those doctors was the one who was administering anesthesia, and that, of course, I don't need to tell you, it's very critical. If the dosage goes wrong, in the heat of the moment, the patient could have died as well.
I think doses, if the doses are also going wrong, then the person should not have degree. So I will not go to the extent that doses will go wrong, but yes, your attention, your mental balance should be absolutely there. This is a question of life and death. You are rescuing a dying child. I will tell, and they have not, actually, that duty they have not done. I'm not saying that this was a healthy child and that child has died because of the negligence, but whatever they have done is punishable, and to what extent it is to be punishable is to be deliberated, and legally all the provisions are to be explored.
Thank you, Dr. Sood. Can you on WION promise us that you will look into the matter personally and you will ensure that whatever is the right punishment for these doctors or these nurses who were present in the operation theatre during that critical surgery, appropriate action will be taken?
This is the job of the council also, and also the rule making is one side, and following those rules is another side, and we have to follow.
Right.
The conduct is important. The doctor's conduct was not as per the medical ethics.
Right. Dr. Sood, please stay with me. Dr. Mishra, I'll come back to you in just a bit. For our viewers, the healthcare sector in the country is currently facing tough challenges as the government is spending in this area. It's been coming down over these years. Dr. Mishra, I'll come back to you in just a bit. An update first on how much India really pays attention or spends as far as healthcare is concerned, the specifics. Even now, the government is not prepared to increase the expenditure on healthcare in tandem with trends in other developing and developed countries where spending is around 4 to 5% of the gross domestic product. India fares amongst the worst in terms of spending on healthcare, which currently stands at around 1% of the GDP. The centre has cleared the long-awaited National Health Policy, or the NHP, this year, which promises to increase the spending to 2.5% of the GDP in a time-bound manner, and also guarantees healthcare services to all Indian citizens, particularly the underprivileged. This March, the target set by the last NHP, that is 2002, of raising the expenditure to 2% of the GDP, it hasn't been met. And this is important. 15 years later, it hasn't been met despite massive infrastructure needs and resource crunch. In fact, government officials have admitted that the country is failing to utilize the health budget. And the Medical Council of India says there are around 9.29 lakh registered doctors, which means doctor-patient ratio is abysmal, 1 to 1,674 patients, against the norms set by the World Health Organization, which says for every 1,000 patients, there needs to be one doctor. Dr. Mishra, it's clear this is one of the problems. Why should we believe that this new target under the NHP that the government has set of increasing the health expenditure to 2.5%, it will be met when they've missed out on the previous targets? Clearly, health doesn't seem to figure when it comes to priorities for the government.
Yeah, that is something which the public at large will have to demand. Good and decent healthcare to everyone, reasonable healthcare, what I call, may not be 5-star healthcare, access to healthcare, it should be affordable, and it is not really a rocket science to provide that in today's scenario. We are in 21st century, everything is known, we have known diseases like Gorakhpur incidents. If you take, it has been happening year after year, there have been some vaccine used against Japanese encephalitis. Why can't we prepare well in advance and prepare for the number? We have the statistics, then how many patients come in, what kind of a preparation is needed. Everything is doable if there is a will. There has to be a will, and then only we can achieve that. The public has to demand, unless we have health an election issue. It has never been an election issue like in developed countries. So even parties don't care what kind of a healthcare is provided, because it has not been an issue at the time of election, who wins, who loses. Like in USA, if you look at, UK, you look at,
Absolutely.
The elections are fought on health issues and parties win or lose on health issues. In India, it doesn't happen. Once they don't get the proper healthcare, then people cry, and we respond to a crisis. Now in Gorakhpur, what can you do now? The children are dying, they have died. You may set up any number of inquiry, you may
Absolutely.
suspend any number of professionals. That is not going to solve the problem. Problem is, can you avoid it next year?
Absolutely. I think you hit the nail. You hit the nail on its head. Dr. Rajiv Sood, last reaction. I completely agree with Dr. MC Mishra over there. We have to find solutions. Enough of setting up inquiries, enough of, probing investigations. In fact, Dr. Rajiv Sood will be joining us shortly in the studio, I'm being told. Let's just talk a bit more about this. Dr. MC Mishra, it's clear now that India obviously doesn't spend enough on healthcare. But do you also get a sense that India has stopped valuing human lives? I mean, these cases are just so common now.
I cannot agree more with you on this, because we have actually, in every aspect, we have no respect for life. And things, just let it happen. You saw 30 young, healthy people died the other day in Panchkula. Where is the value of life? And we just let things happen, and in natural course they should settle down. We never are proactive, preventing things from happening. And you saw how the High Court has passed observations that enough was not done by security forces. So I think this is something which is very commonplace in India, and we have to change this actually. We need to change this. We cannot let it go on and on and on that we do not value life. I think this is something which all of us have to be awakened and demand that this has to be, this health needs to be improved, healthcare needs to be improved, and there are ways and means. There is enough data we have, there is enough know-how we have, how we can tackle these problems. If there is a will, there is a way to deal with these things. And naturally, the funding needs to go up. We cannot just depend on less than 2% of GDP in the healthcare. The state governments have systematically, miserably failed in providing healthcare to its citizens. And
Absolutely.
Naturally,
Dr. Mishra, let's also get Dr. Rajiv Sood in. He's now with me here in the studio. Dr. Sood, we were talking about this. I mean, how many inquiries will the government set up? How many investigations will the government carry out? for an instance which takes place in Gorakhpur, the Japanese encephalitis deaths that take place every year, this is something which we already know, and one can perhaps even predict that next year the situation will be similar. It's really sad.
In India, the communicable diseases which are there, they are taking their toll year after year, and that's why from the beginning we are mentioning that the GDP is to be increased, and the bureaucratic attitude which is there, that you are sending the files one officer to another officer, it should be transparent. Now we are talking about digital India, and it should be digitalized. Right. You should know where is the file. We have the file tracking system, and we should know that payments have been made or not, or what has retrospectively conducting inquiries, wasting time, and then we reach the next year. And in the next
But who is to blame in these cases?
The whole system is to be revamped, and one thing is there, we should be sensitive to the, not only that what is the behavior of the doctor, what is the behavior of the staff, but we should be sensitive to the infrastructure availability and the procedural, the SOPs, the standard operating procedures should be thoroughly revamped. And the GDP, see, on smoking, we are not able to ban smoking. In some of the states, we have banned alcohol. But 1.7% of GDP we are losing because of the health problems in smoking. So if we can ban smoking, that GDP can be added. So for certain reasons we are not able to do that. There has to be political will, and there has to be application of the proper system.
You're saying it's a manifold approach.
It is manifold
one solution
approach. The
is
whole
not going to get the
system should
results.
be relooked.
Right. Okay, I take that point as well, but what we want is immediate answers as far as these deaths are concerned. These are three separate cases that we're looking at in Jamshedpur, then in Gorakhpur in Uttar Pradesh, and now in Jodhpur. Three completely different cases, but all point out towards just one thing: apathy, medical apathy, the lack of it in the system in the country, and that needs to go. Thanks so much, Dr. Rajiv Sood and Dr. MC Mishra, for joining me on the show. That's it then.